YAC Against Cancer, with the help of the York Press, launched a campaign to build the cancer care centre at York Hospital. The area at the hospital is meant for people and who are suffering with cancer, their friends and their families, and it's somewhere where they can go to that is a non-clinical area, somewhere where they can go and have a cup of tea. They can sit down and talk to somebody if they wish, or in fact they can just sit and be quiet and be alone for a while.
I've worked in the cancer care centre for since it started in 1998, so and for all that time the role has really been about developing services in the cancer care centre. It's really important that we treat the patient as a whole, holistically, and that we don't just consider the kind of core, if you like, the core treatments and diagnostics that we have. Psychologically, to first of all have a diagnosis of cancer, that's very hard hitting, and people can have a number of reactions to that.
It's very common for people to have a level of psychological distress and adjustment when they're diagnosed with cancer. That's just normal, and most people get through that with the help of friends and families and maybe the GP or specialist nurse and the cancer doctors. But there are a proportion of people who go on to have significant clinical psychological problems like clinical anxiety or depression. Most patients are referred to us by their cancer specialist nurse or cancer consultant, so we're very linked in with the cancer services here at York. Psycho-oncology services aim to be responsive to patients, so if somebody's struggling with a psychological issue, we want to be able to see them fairly quickly, because their problem might get in the way of their cancer treatment.
They also have rooms there where they're used for housing clinics, and the clinics involve complementary therapy. And amongst the therapies offered is aromatherapy, Reiki, massage and acupuncture.
I provide clinical reflexology, clinical aromatherapy, and also different forms of massage therapy based on acupressure. Often I see people before or after they receive chemotherapy. It does humanise the experience of receiving chemo and radiotherapy, because you do become very fearful, so it is extremely relaxing and humanising, and it can just help people through.
The salaries of the receptionists that work at the cancer care centre are paid for by YAC Against Cancer.
I'm basically here for whatever the patient's needs may be. It could be information, we've got a wide range of information in the centre, or it could be linking them up with the benefits advice service, or booking them onto one of our new services, Look Good Feel Better, which is for ladies. It's a service that's been sponsored by the beauty industry, it's their charity, and it allows workshops to be held in various different hospitals in the UK, and for a maximum of about 12 ladies they come in and they have a full makeup routine done with beauty therapies from the beauty industry itself.
One of my roles is to coordinate the SASSI, that's Silks and Scarves in York, that help ladies with hair loss. It's funded by the Cancer Care Centre Charitable Fund, so all the products that we buy are through fundraising. Our patients have varying degrees of cancer and different stages of cancer. They may be at the beginning of the treatment, or middle of treatments, or end of treatments. So it's different stages, isn't it really? No patient is the same. They can come here at the beginning of the treatment and we can give what information we can via the booklets, and if they need to require extra assistance we get one of the consultants or the clinical nurse specialists to come and see them.
I find it extremely satisfying. It's a lovely job and it's a real privilege to be able to help people.
When people talk about job satisfaction, it is the ultimate in job satisfaction.
Yeah. It's a real privilege actually to talk to people when they're at this very turbulent time in their life.
And I can't imagine not being here. I mean, YAC Against Cancer have done us the best favour ever.
They have.
By allowing us to work here. and that's how I feel.
I came to the post in 2005, and York Against Cancer had already funded the psycho-oncology service for a 3-year period.
For a local charity to be able to do that, to put the money back into eventually caring for patients locally, is just the most phenomenal thing, really.